It's been really a pleasure to be here with Governor John Bell Edwards and mayors from the local community, as well as the administration, faculty, and staff, and the students of LSU. And it's been really a privilege to travel the nation. We've been to 28 states, and I think 15,000 miles of really learning from states and governors and their leadership, and learning from students and administrators of how to work together in partnership to address this COVID-19 epidemic. What I've learned from here, and particularly from Louisiana, and I think everyone in Louisiana should know that Louisiana made changes that saved people's lives, both in the March, April timeframe in New Orleans and in the summer post-Memorial Day surge throughout the state. So it was only 2.5 months ago where about 80% of every parish in Louisiana had more than 10% tested positivity. It didn't matter if you were a rural parish or an urban parish, extraordinary viral spread throughout the state, most of it beginning asymptomatically. And so really, we've learned from Louisiana that masks work. We just saw the wastewater data coming from this university really showing that 2 weeks after the mask mandate really resulted in dramatic decline in wastewater viral levels. And I think we've learned that masks work, we've learned that restrictions of indoor dining work, we've learned that closing bars at a time of high transmission definitely works. We found that physical distancing, but most importantly, we found that engagement of the community works. The community in every Louisiana were willing to make those self-sacrifices for each other, to really respect one another enough to physically distance, to respect one another enough to wear a mask, to respect each other enough to wash their hands, and respect each other enough to make those changes in their daily behaviors that kept them from getting COVID and also kept their loved ones from getting COVID and their neighborhoods. And I really want to applaud the leadership of the governor and the leadership of the university. We were meeting with the students and we talked about what's really difficult in the time of COVID-19 to be back on campus and what that meant relevant to restrictions. But we also talked about how administrations that opened their universities spent the spring and summer planning every single aspect of that. And we got an excellent presentation from the COVID response team here at the university, who really spent the summer really figuring out how to logistically bring students back into this college experience as safely as possible, and continue to learn from that, and really very much focused on data for decision making and making changes based on that data. And I just want to applaud the administration for really believing in their students and their faculty and staff to really bring people back and figure this out together with the students. Just like it depended on the people of Louisiana making those changes, it depends on every student at LSU to continue that behavioral modification of wearing their masks not just on campus but off campus, to really restricting their significant gatherings. We talked about pods and forming pods with close friends so that you know what those friends are doing, you know what you're doing, and you're keeping each other safe. And I think that's really extraordinary. And we talked about the importance of increasing testing on campus to really understand the breadth and depth of the viral spread. And I think that what they're doing with wastewater now and being able to see where there could potentially be hot spots and going in there and testing is really going to be key. But it's been a privilege to meet with administrators across the countries and presidents of universities and university systems, because every one of them is motivated for not only the health of the student and ensuring their educational experience, but also the health of their communities. And really seeing that linkage of partnership back to the community here and ensuring that that occurs simultaneously. So really, it's been a privilege to be here. I will take a few questions, and then I think you're going to hear from the governor and LSU. Yes.
Dr. Birx, in terms of Louisiana's current level of restrictions, particularly on bars, that's obviously been a point of contention here locally. Do you think that the state has the appropriate level of restrictions in place now, and is there anything you would recommend that the state change?
So there's a daily, weekly report that comes to every governor. It's been written for the last 3 months, and it really talks about, going from 80% parishes above 10% to now one parish above 10%, showed us that this mitigation works. We're coming out of Labor Day. We're coming out of universities and schools opening, and so it is extraordinarily important and prudent to maintain those restrictions and ensure mask usage, physical distancing, and preventing. If we could have bars where everybody was physically distant and never taking their mask off, then that could be a discussion. But certainly we know that when you take your mask off and you're indoors, and I think your question's really important, because what we learned across the South, this is really important for the rest of America, we learned across the South what happens with seasonal movement indoors. So the South moved indoors because it got too hot, and you can see what happened with viral spread. Soon, the rest of the country will move indoors to be warm. And so we really need to ensure that this precautions that are really being utilized here continue until we see how the Labor Day situation goes, how the schools and university coming back, and the case structure, and then really seeing what happens with the winter, the fall, and understanding what happens with flu. And so I think now is not the time to really loosen restrictions. Now is the time to make sure that we're all doing everything we can to bring cases down even further, which we know is possible, so we can go into the fall in a very different place. Yes.
Dr. Birx, obviously here at LSU on Saturday, LSU has its first football game at Tiger Stadium. 25% capacity, roughly 25,000 fans. Obviously, football has been something that's been discussed for months with you and with other people. Are you, knowing where Louisiana stands in the data, comfortable with 25,000 people? Obviously, a large gathering. Are you comfortable with that size? And then coming out of that football game, making sure that there aren't outbreaks because of it. How do you manage what capacity is going forward?
I think two things. I think you need everybody moving in the same direction and respecting the restrictions and regulations. So certainly you can be physically distanced when you cut by 75%. Certainly you can bring people in a staggered way. And it will what every single person needs to do is make sure that they're maintaining that physical distance if they have to get up and go to the bathroom and come back. So what you can't have, and I'm sure they'll have people in the stadium to make sure that that physical distancing is maintained at all times. And I think that's really important. Of course, it's also outside, and we know with airflow that is also quite important. And so we'll be following this very closely. That's how we learn. We learn from controlled events for which we have clear data. Now, what I want to really say is, those of you who thought you wanted to come and tailgate, to the parents and alumni out there, these students are doing everything possible to decrease COVID spread. Do not come on this campus not wearing your mask. Do not be in bars and the local, don't create your own bar situation in your hotel room or in the lobby or in some unknown place, because you will create viral spreading events that then people will not be able to separate from the game. So this is really important for us, all of us, to take those precautions going into Saturday.
Dr. Birx, can you talk a little bit about vaccine rollout? And I'm also wondering if priorities for when vaccines get rolled out, if Louisiana might be given some priority, given that we've been one of the hardest hit states in the country.
So that's a really critical question. And so there's outside groups really providing the federal government recommendations. And that's really important to get everybody thinking about this and understanding that. And I think it really comes down to, we know now, due to very careful research, who's at risk for both hospitalization and significantly poor outcomes. And those are comorbidity independent of the age group. And that's an important part. And then certainly older, over 70, and comorbidities. And really understanding that is important. But the other part of that that's inherent in vaccines is understanding whether that particular vaccine produces immunogenicity in those risk groups. And that's why it's really important that people participate in the trial that come from those risk groups, so that when we finish the studies, we'll be able to say, if you have diabetes, hypertension, if you're on dialysis, if you have COPD, if you have these risk factors, this vaccine was immunogenic, and therefore, and efficacious and safe, and we believe that you're the risk group that could benefit the most. And so it may come down to specific vaccines for specific risk groups. And so the luxury that we may have in the next 3 or 4 months is multiple vaccine products that actually have efficacy. And then we'll be able to really define which vaccine type is best for which specific age group. Now, just to be clear, there's 3 different platforms for how to express this protein, but it's all against the spike protein. But certain immune systems, because as we get older, our immune system is not as agile as it was when it was young. And so there may be certain vaccines that work better in older age groups. And so that's the real important information. And I'm just pleased that we might have the luxury to be able to really match vaccine efficacy and safety with specific immunogenicity to really utilize the most effective vaccine for each of the age groups.
Dr. Birx, how long should the current set of mitigation measures and guidelines stay in place?
So we know that in the Northeast, and they were very different, I just want to really make it clear, no one has suffered the level of mortality as the Northeast, particularly in the New York City metro area. And we know that the New York City metro area is a bit unique and has what we call the highest antibody levels. That means that they had the highest % of their population exposed to this virus. But we also know that that came at an enormous cost. They have a mortality rate that's 2 to 3 times other states, certainly twice Louisiana. So that's what we really want to make sure doesn't happen again. Now, the Northeast has been very quiet through the summer. If you look at New Jersey, if you look at Massachusetts, if you look at New York and Connecticut, Rhode Island, their cases are ticking up a tiny bit. So we would like states to be less than 3% and less than 5 cases per 100,000 per day. So that, Louisiana is getting there, but we'll have to continue. And how fast we get there depends on all of us, because it's strictly how we interact with each other and how we protect one another that determines whether the virus spreads or not. And so it is completely under our control, and I know people are getting tired of this, but we need to get through this fall, and we need to get to the time where we can at least immunize the most vulnerable among us, because I'm sure you all share my belief that no more Americans has succumbed to this disease than has to, and that has to depends on us to really protect one another. So I'm going to stop there and let the incredible Governor John Bell Edwards speak, and thank again the university for the warm reception. Thank you. It's good to see you again.
Very much. Thank you for being here. So as she leaves, I do want to thank Dr. Birx for coming to Louisiana again. She was here 2 months ago, a little over 2 months ago in July, when things were much different, and quite frankly, we made a lot of improvement. And the reason we've made improvement is to a large degree a result of the work that she's doing on the White House Coronavirus Task Force and all the recommendations that she made to states such as Louisiana that we have implemented. And so we are doing better, as she just mentioned. The gains are somewhat tenuous and fragile, which means that if you get rid of the mitigation measures and the restrictions that allow the improvement, then the most likely outcome is that you lose that improvement and you go back to where you were, which is why we're trying to be very deliberate in the way that we move forward. But it's all informed by her work, and as you can tell, she's got a grasp of this subject matter that is probably second to none in the world. And so she's been a valuable partner for us. I want to thank President Galligan for being a wonderful host today, and all the leadership that he's providing to the LSU system, which, by the way, is not just limited to LSU. We have all system presidents here today and represented, and the things that we're learning, we want that across all of higher ed in Louisiana. I also want to thank the students who came out today, because I've never been more encouraged, more optimistic about our future than leading that roundtable discussion a few moments ago, where students were able to express concerns, issues, ideas that they had, which really were all very thoughtful, and they were all very articulate, and anyway, just very, very inspirational. And finally, I just want to ask people to continue to do what has been working, especially as we do new things like the football game this weekend. Obviously, there are rules in place, there are restrictions in place, and we're asking people to be physically distant, to wear your mask, to make sure that you're very careful. Don't come if you're sick. If you're vulnerable, watch it from home. Watch it from home if you're vulnerable. And then let's prove that we can do this safely, and that we can continue to have spectators at our games for the rest of the year. And I'm also looking forward to seeing LSU defend successfully its national championship, Mr. President. So I know that we're going to be successful at that as well. But I'm going to ask President Galligan to come up and share some comments with you. And then if you have a couple of questions on the backside of that, I'll be happy to take those.
Thank you, Governor, very, very much. And I, too, would like to thank Dr. Birx for her great work and also for a wonderful, wonderful visit today. We had fantastic dialogue. We learned a lot. And I, too, would like to thank our students. They have been and are fantastic. And Governor, thank you for your leadership. He's heard me say this before, but he was in my admiralty class in the fall of 1997. He was my student, and despite that, he has succeeded. And what I would say is, and I've said it, and I think this is the third time, but I'll keep saying it, no teacher could ever be prouder of a student than I am of the leadership that he's provided. So, Governor, thank you very, very much. What's the biggest takeaway we got from today? The biggest takeaway, I think, was something that we already knew. We need our community to get tested. We need to have more robust tests. We need more numbers. So the best we can do to encourage, to implore, maybe to require faculty, staff, and students to get tested so that we have the most accurate data we can is absolutely crucial. So I'll stop there. I'll thank you all for coming. I think this is what, our fourth weekly press briefing. And this week we brought the governor and Dr. Birx. Next week will be a lot calmer. So, questions?
I have a question for Dr. Galligan.
Yes.
Did Dr. Birx recommend some sort of mandatory testing on LSU's campus or some approach that is more than just volunteering for tests?
I would say she encouraged us to consider ways in which we could get more students tested. Whether it's required or now we're doing the wastewater testing, so what we will do with those results is we will have, if we see high numbers in a certain place, we will get those students tested. So she certainly encouraged and urged us to try, and the students, to get tested.
So is that something you're going to consider to do a mandate of some kind?
I think we'll think about a mandate. I don't know if we'll go so far as an absolute across-the-board mandate, but you've seen what we've already done is we said if you want to get priority for football tickets, you've got to get tested. And we looked at our daily test results, and they literally, not results, the numbers, they shot up. So those sorts of incentives, quasi-requirements, I think will be very, very effective to get more people tested. So I would expect you'll see more of those.
I guess going off her question, I know in the first LSU media briefing 3 or 4 weeks ago, whenever it was, you said again, possibility down the road, mandatory testing. Prior to that incentive to get priority on tickets, testing really wasn't moving at the rate you wanted. I know Dr. Birx has previously mentioned possibly thousands of samples on a college campus daily. I mean, in the months since you first talked about a mandatory requirement, how big of a possibility is it? Because without that incentive, the numbers really aren't moving testing-wise at a huge pace for the size of LSU's campus.
Yeah, I would say it is a possibility, but I would say that the first steps would probably be, again, we see the treatment results we get on Friday, the wastewater test results would be to say, okay, If the numbers are high in a certain cluster of residence halls, then those folks get tested. We're now testing folks in quarantine. So yeah, we need to have more tests.
President Galligan, hearing the stakes about tailgating and the game day from Dr. Birx and understanding that this is kind of a test run for the school, how high alert are you guys on for this weekend, and what measures are you going to take to ensure that tailgating and things like that don't happen in a way that's dangerous and violates the rules?
Yeah, we're on high alert. We're on high alert in the stadium, we'll be on high alert on the campus. So that, and as I think I've said before, our first tack will be persuasive and gentle. But if we have to go beyond persuasive and gentle, we'll do so. Because it's really important that everybody loves to tailgate, but not this year. So it's really important we're not tailgating. It is critical, and we will enforce inside Tiger Stadium. We'll be physically separate. We'll be wearing our masks. And we'll be outside, which is a really good thing. Thanks, Matt.
Governor, are you going to the game this weekend?
No,
Why did you decide not to go to this one? I know you're a regular attendee.
I don't know of a bigger fan of LSU football than myself, but I won't be at the game this weekend. And quite frankly, just looking at different things, and this weekend, I'm actually not going to be in town. But I do encourage those people who go to be mindful of the rules and restrictions, because we want it to be a safe event. We want this to work. We don't want to have any reason to second guess having spectators at these football games, which is why the rules are in place, where there's 25% occupancy, the need to be distant from people not in your party, the need to wear the mask when you're not actively eating or drinking. Watch when you go to the concession stand or to the bathroom and so forth, and minimize your movement and your contact with other people as you ingress and egress. All of that is critically important, and we really want this to work. And not just at LSU, but this is happening around the state at all the universities that are playing football right now. And hopefully it'll be successful, and we can learn ways to actually make it more successful over time. And I'm looking forward to a good score at the end of the game too, Mr. President.
I'll do everything in my power.
Yes.
You mentioned not going to be in town for the game this weekend. When asked if you're going this year, would you be comfortable feeling safe going to a game in Tiger Stadium?
Yeah, it wouldn't, if it's not safety, first of all, we wouldn't do it if we didn't think it was safe in the way that we do it. So my not going has nothing to do with not feeling that it's safe. And so I just want to reassure everyone of that. We had our public health officials look at this. LSU independently had physicians and scientists take a look at this. They developed an exhaustive plan that is well beyond anything that I quite frankly had imagined that you all would do, in order to try to change the game day experience to make it safe, but also make it where you can enjoy LSU football in person. So if I didn't believe it was safe, we wouldn't be executing the plan the way that it's set up. Yes, ma'am.
Governor, do you think that having Dr. Birx here today and a comment she made is somewhat helpful to you going into this special session when legislators are obviously targeting your emergency authority and criticizing the restrictions you've put in place so far?
Well, for those people who listened to what she said, paid attention to it, it certainly should be. I mean, she runs the task force for the vice president. She's running the White House Coronavirus Task Force. She knows the data in Louisiana down to the parish level. She's been making recommendations for weeks and weeks and weeks. We talk by phone frequently. This is her second trip to the state. And the recommendations that she's made have been those things, by and large, that we've done. And they have proven successful. And so I would hope that the folks around Louisiana were paying attention to her words. And I certainly hope that's not lost on the legislators, because we all have a common interest in promoting public health. And if you move away from the things that have worked, then you jeopardize public health. And by the way, it isn't like you can have the economy fully open with a virus running rampant. That just isn't going to work. And so you have to strike the right balance between the economy on one hand and public health. And if you want to open more of the economy, if you want to open your higher education campuses and your schools, if you want to have the most normalcy that you can have, you also have to be safe about it, which is why you do it with a mask on. And you do it 6 feet apart. And you wash your hands and you stay home and you're sick. And it's quite frankly perplexing to me that some of the people who demand that we open more of our economy are the ones who insist, but don't tell us to wear a mask. You can't do those things successfully if you don't tie one to the other. And if you look at the restrictions we have in place in Louisiana, they're in many ways less restrictive than other states who actually have had fewer cases than Louisiana. And so I would hope that legislators are serious and responsible, that they are listening to what she is saying, and that they're looking at what we're doing in Louisiana, seeing how effective it's been in light of the challenges that we've experienced, and also looking at comparatively what we're doing in Louisiana relative to other states. If they will do that, then I have no concern about how this legislative session is going to end up. One more question. Yes, sir.
Compared to Dr. Birx's visit in July to now, I guess in meetings with her in the roundtable, I guess what was her biggest concern where Louisiana stood then versus what her concern in this stage of the pandemic is here?
Well, in this stage of the pandemic, we're all looking forward to a fall flu season. And knowing that the flu and COVID are both respiratory ailments and they place demands on the same parts of your healthcare delivery system. It is very concerning to know that you could have the next surge in cases for the coronavirus at the same time you're having significant cases of the flu. And that would be tremendously devastating to our healthcare delivery system. And as we learned over the summer, and this was kind of different than what we experienced in March and April, the biggest challenges about delivering healthcare over the summer had to do with staffing, doctors, nurses, respiratory therapists, and so forth. There are only so many of excess surge capacity healthcare professionals in the country. And if you have too much of a surge across too big a part of the country, you're just not going to be able to meet the demand. But the good news is the mitigation measures that work against COVID also work against the spread of the flu. So if we wear a mask, if we're physically distant, if we're washing our hands, if we're staying home when we're sick, then we're going to see the flu cases that should not materialize to the degree that they otherwise would. And I'm encouraging yet again, everyone, whether you typically do this or not, everyone please get a flu shot this year. Very, very important. And if we'll do that, then we're going to be successful. And one of the takeaways that I had from her is that the next 45 days or so are going to be incredibly important to keep the current restrictions and mitigation measures in place so that we know where we are as we transition into fall and we can make informed, really good, deliberate decisions. We don't want something to be haphazard and then we're responding to it later, because between now and the end of the year is really, really critical. So that was some other things that she said today. Look, I want to thank you all. I don't have the COVID numbers for you yet. There was a delay in reporting, and I've been in meetings, so I can't tell you what that's related to, but hopefully we'll have the numbers out to you very, very shortly. Again, I want to thank Dr. Birx, not just for being here today, but for the partnership that she and her folks have had with Louisiana and with me personally for many months now. And President Galligan, thank you very much for your leadership here and for being a great host. Go Tigers. We look forward to beating the Bulldogs on Saturday. Thank all of you. Appreciate it.
So thank you all for coming.